Oh, it's connected to audio. That's
Oh, wait, no, and then they were out. Well, yeah.
I'm supposed to throw it in one.
Yeah. Wait, zoom in on the questions, I can't. All right, thank you. So we're just going like this way, I guess we'll. It must be intimidating. Why are you in this room? And
Their microphone is off. Are they not loud?
I think they're figuring it out right now. Because she said, "Can you see us right here?" I said, "No, we can't see here." Hey.
Okay, the camera.
Dora, big.
Hey, hi guys.
Hello.
Hi.
Can you give me your names so I'll know?
I'm Jericho.
Okay.
I'm Connor.
Bella.
I am
Diana.
Grayson.
Okay, it's good. I was looking at the list of questions that can you hear me?
Yes, it's kind of
'Cause
cutting
I'm
out
on-
a little.
I can just do without these things. If
No,
that's
no, you're
easy.
good.
I'm good?
Yeah.
All right. And I understand it's we have to do at least 30 minutes, and we can do free exchange of ideas and things like that. And you can feel free to ask me anything you want other than what's on here. And, if you have a question about what, and does anyone have any questions now pertaining to any of this? Well, go ahead, Bella.
I think we can just start with the questions that we have. We can start with number one. And then if any questions, branch off. One of us will just butt in.
Okay, now the one thing I want to know is what is your major? Can we start with you in the corner here?
I'm a biology major.
I'm a math major.
Okay.
Biology.
I am a bio major as well.
Okay, and you all are about the same level, first year?
Yes.
Okay. Where are y'all from? Tell me. You over here? Where are you from?
I live in Kyle, Texas.
Okay.
I'm from Houston.
Okay. I know you from San Marcos. How about you?
I am from down south in Corpus.
Corpus. Okay, so we've got most of the state represented except for far west Texas. Okay.
Yes.
And I am, Bella's aunt, but I'm also her employer. She works at this office sometimes, since we have this interesting relationship where she's worked for me since she was almost a toddler, and we have a family medicine practice. It is in Northwest Austin. If you all are familiar with MOPAC or Loop One, we are over by 2222 and MOPAC. So it is a lot of families out here. My office was located by the university for 20 years. I had an office right across from St. David's Medical Center for 10 years. And then I had an office in an area called Medical Arts Square, which is right across from the Thompson Center. You all might have been through there, and it was a bunch of little offices. And I was there 10 years, and then I came out to Northwest Austin. We've been here 11 years. And one of the issues was, economics. It's always about money. And the rent around UT got pretty expensive because all of you guys were coming to school and paying rent, and it made it harder for all of us to keep a business around there. I am in family medicine, so I don't need to be near a medical center. And so that was about the recommendation from the people I knew, that was to move out to where the families are. And this is how we ended up in Northwest Austin. A lot of my patient population is families, mostly a lot of women, and in the ages from about maybe 30 to 60. And we have we see somewhere between 10 to 15 patients a day if they're extended visits. And then when it's a younger population, we can move through the patients quicker. But your average family medicine practice will have you'll see about 10 to 20 patients a day. That's in a clinic setting. Now, there are urgent care centers where you're going to see a lot more volume. And I don't know if y'all ever been to an urgent care center, but that is a really busy place. And the first question is, what exactly is family medicine? So we're into that now. And how did you come across the field? And I came across the field of family medicine almost by accident. Okay, I thought I was going to be an internist because my first degree is in pharmacy, and I was a pharmacist. And I thought I was truly prepared to be an internal medicine physician, which are more office based. I mean, hospital based. And then I ended up having to be a patient, got sick, and needed surgery. So on the way to Del Rio to pick up my family so they could be with me, I stopped in Austin, and one of my friends was a family medicine resident here at a place called Brackenridge Hospital, which is now the Dell system. And so he took me around, showed me, and I became really interested in it was a new trend. Family medicine has only been around since the 1980s, late 70s, and then 80s. And so on the way back to UTMB, where I went to medical school, I decided I changed my sentiments towards medicine. I wanted to be a family medicine. And what I had realized is that I grew up in a little small town, Southwest Texas. And the doctors that treated me were what we used to call generalists. And they did a little bit of everything. A lot of them were trained in the military. And so they did surgery, they prepared hips, they did colonoscopies, delivered children, did major surgeries. And so that model of a physician was more of what I was accustomed to. And so I chose to go in that direction. But I trained in the 1970s, late 70s, 80s. When I decided to become a physician, I'd never seen a female physician in person. And so the models I had were these guys, they were all men, and they did a little bit of everything. They came to your house to take care of, kids when they were having a high fever, and the parents didn't need to take them to the emergency room. So that was my exposure to family medicine. And so I ended up matching with the Brackenridge program. They took 6 residents every year, and I was able to get here and become a resident. And so that was how I ended up in family medicine. Any questions? Anybody?
Yeah, so I was just wondering, so compared to like internal medicine, what specifically from family medicine drew you towards the field?
I like variety. Okay. What I had learned in medicine was that in training, because I went to UTMB, I don't know if y'all are familiar with Galveston, but it's big medical centers and a lot of specialized care. And I like just variety, to be able to do a little bit of this and that and whatever. When we hire UT students here, pre-med students, and when I mentor them, I always tell them, we never know what's behind door number 3. Okay, I mean, you can go from seeing someone we know with scabies or an STD or a heart problem to someone having a psychiatric panic attack. I mean, that's the variety you see in family medicine, and it can change from one room to the next. And I like that variety. I like the intellectual challenge of internal medicine. But I didn't want to see a lot of chronically ill people, for the majority of my practice, which is what internal medicine is. They take care of a lot of chronically ill people. And also internal medicine is what you do if you want to become a specialist in like cardiology or, endocrinology, some of the specialty areas. You have to go through an internship and residency in internal medicine first. Anybody else?
Other than family medicine, what other medical jobs / opportunities have you had post medical school?
Well, I was a registered pharmacist when I went from one to the other. Okay, I went to UT's College of Pharmacy, and so at the end of that, so I ended up going to medical school and working as a staff pharmacist while I was going through medical school to try to make some money, get some funds to do other things like take a nice vacation. And so I did that, and then when I came out of medical school, the state of Texas was in a terrible recession. That was the 1980s, late 80s, and there was almost no jobs available except government jobs. And so I went to work for a state agency that gave me the opportunity to work in administration and general medicine. It was in the mental health system, and they paid off my student loans. And so I was able to stay in the Austin area and work there for 5 years. And I believe that's still available. And you can, as long as you're willing to go where nobody else wants to go. Okay. And, because of course everybody wants to go out and do the fun stuff, all the lucrative jobs available. But in a recession, there was not anything available like that. So I worked for the mental health system for 5 years. And then while I was starting my private practice, I worked emergency room medicine for a company called MCare. And I worked in level 3 and 4 trauma centers, which are most of far West Texas, South Texas. And they usually hire family medicine physicians. As a family medicine physician trainee, you get to rotate through emergency medicine and surgery, psychiatry, OBGYN, and then of course all the specialty care training. So we're very well equipped to work as the front lines in an emergency setting. And so I did that. I also work for a drug development company. I've done that a couple of times. And what I would do is I work for them early in the morning, and then starting like at 9 o'clock or so. And the one that's left is Pharmaco. You may have heard of them. And they hire students to go be like a guinea pig. And we do all this testing on the students, and you get paid really well. You get to have some fun. I did that for about 10 years during my while I was working my family practice. And let's see, that all the things I've done. That's about it. The nice thing about family medicine is that it allows you to do things like that, where you have a good core of knowledge in many different areas.
So which would you prefer now, the fast-paced conditions of the ER, or a more steady job that you have now?
No, I loved working emergency room medicine, but it is hard work and physically hard. And it is like, if you're willing to go where nobody else will go, you're going to make a lot more money. And so I went to, you all may know these places. I worked the contract in Snyder, Texas. I don't know if you all ever been out there. It's like somewhere between Abilene and Lubbock. And I did some work in Lubbock. That's before they had a medical school and all that. So they were severely short of patients, of doctors. I worked a contract in Del Rio, where I'm from. And so I would go and work a 48-hour shift straight. And then I was off for a whole, 2 weeks. And that's the way those jobs work. And, so So I could go and work there for 48 hours straight, come back, and sometimes I would work in my office if I've had enough energy. Otherwise, I would go home and sleep, and then see the patients the next day. So I would have my family practice going, and I was also every 2 weeks, weekends, I was working an emergency room contract. Emergency room is a lot of fun, but it is very hard physically because if you get time to sleep, you sleep. If you're working those long shifts, one of the things that has happened is some of those conditions don't exist anymore. Like the laws have changed, and as physicians, we're not allowed to work like that anymore. But back then, we would work, 48 hours straight, sometimes 72 hours straight. And if you got to nap for an hour or two, they all had facilities where you could nap. I mean, it's something. It's adrenaline rushing kind of stuff, just like you see in the movies. I mean, it's a lot of exciting stuff goes on in emergency room medicine. But you at some point you really want to sleep in your own bed. Anything
right.
else?
So we can follow up with our next question. What was the hardest course you had to go through in your path to becoming a doctor?
The hardest course, and I went through UT Austin, was organic chemistry the first semester. Okay. Yeah. Have you all had that yet? Not yet. I took it with a fellow named Dr. Roberts. There was the two big professors in my time were Dr. Roberts and Dr. Welch, like the Welch building.
Oh,
That's cool.
Yeah. and Roberts was the one that taught us the first semester. And he, when he opened the, it's big auditorium, and students. So we had pre-meds, pre-dance, pre-pharmacies students, pre-vet students in there. And he opened the class, and he wrote on the board, and he wrote, if you can make a B in this class, at least a B, you will get into any professional school you want. And then he got a big smile on his face, and then you've probably seen him Welch those old they're like chalkboards, and they slide back and forth, and he had an eraser, and he would just write and slide, and you had to keep up with what he was doing. I went out and bought a multicolored pen. I don't know if they make them anymore, but it has all these, like you could write in green and red and blue, black, and that was the way I was able to keep up with the reactions and the reagents and things that he was writing. And part of the problem was I was not prepared for that intensity. And I was hanging out with some of my friends who, were political science majors, and they were education majors, and they were having a lot of fun. And so I was out with them some, not thinking that I needed to, be more focused. And so I lost like 17 pounds that semester, because when it hit me that I needed to get moving, I just quit going anywhere. I was eating some, but not hanging out when I'm not much of a cook. And so my family sent somebody up here to check on me because I wasn't going home and that kind of thing. But I ended up making a B in the class, which was my goal. But it was, I had to give up a lot of things to get there. And but it was, I quickly made up the pounds the next semester. And then the second semester was a lot easier because you get into the groove of the chemistry. And I always tell my mentees, organic chemistry is like learning a language. Once you get get involved in it and immersed in it, it makes a lot more sense. It makes all the connections. I had one of my mentees who came in and her name was Dana, and she said, "Doctor, I'm worried about myself because everywhere I look, I see chemical structures. I can see organic chemical structures." I said, "Dana, you've arrived. You're not going crazy." But she did really well in organic chemistry. One of her recommenders for medical school was one of the organic chemistry professors. And so it is doable. You just have to, you're going to have to focus. But I took, I went through medical school, pharmacy school. No other class ever hit me that hard. Nothing in medical school was that difficult as that first semester of organic.
I'm a little scared now.
Well, I think that's the purpose of this interview. I think your faculty want you to start thinking about those things.
Yeah, so
Organic chemistry is considered I used to do some when I was in medical school. I worked with one of the programs at UTMB that helps pre-med students, and we were all really aware. We're aware that organic chemistry is the weed outer. In other words, it is the course that will weed out the pre-professionals. So that Dr. Roberts was correct. If you can make at least a B, you're probably safe into whatever professional school you want to go to. Go ahead.
So yeah, I had a question, like, I guess relating back to like all the different professional careers that you've gone through, the different jobs you've had, which one of these jobs used like these advanced courses like organic chemistry or the higher level biology courses the most?
Well, I know it's hard to think that you need to know that material to do everyday functions, but my biology and chemistry background, what it does is it teaches you to critically think. Okay, you're able to look at a situation and take parts from it and make it all come together. And we in family medicine, we deal a lot with a multitude of drugs that we have to prescribe, and it's always, I feel pretty secure just sitting down and talking to a patient about some reaction or the patients tend to be really scared of side effects that they read about. I'm sure you've seen the commercial where by the time the commercial's over, you're terrified and you wonder why anybody would want to take that pill. But that's very common with patients. And of course, if they're scared of the medication, they are not going to take it. They may go pick it up at the pharmacy, but they won't take it. And some of them will even lie to you and tell you that they're taking it, and you get laboratory and you're able to see that, they don't mean to lie. I guess they just don't tell you the whole truth. But I did the research job. Now there we used a lot of the chemistry because we were responsible for monitoring the subjects. We don't call them patients, we call them subjects. And one of the things we did in this job and with Covance, we did it's called level 1 or phase 1 and phase 2 studies. And in phase 1, they take the drug in a IV form, okay? And then the person gets it. We monitor all their vitals and effects. And in phase 2, we take that same medication and we push the doses higher and higher and higher to come up with the maximum dose. Okay, now you've probably seen that, when you look up a medication, max dose is no more than 100 milligrams or no more than 200. Well, somebody has to do the research to come to those numbers. And what we do is we push the drug until it makes the subject sick. I know that sounds pretty scary, but we know, of course, the subjects were all people like you guys. So very healthy. And, we would it'd be a big, like a big gymnasium area, and all the subjects were in beds. And like with some of the drugs, we wanted to see how much drug it took before your heart started doing strange rhythms. So we would have I'm following a technician who's doing an electrocardiogram, and I'm supposed to be there available to resuscitate the patient in case something goes wrong, like the patient has a cardiac arrhythmia and we have to bring them back. And so we would do an EKG every 5 minutes, and we'd be following. We'd had like 70 subjects, and we'd be going up and down. And we did have, with one medication, we did have to send a bunch of subjects to the hospital because they got a lot of projectile vomiting. You may have seen and it was that family of drugs. You've probably seen something called Ozempic on commercials. It was that family of drugs. And I was real disturbed because I was on and I thought I was going to go home and watch the Texas OU game. And because it was going to be quick. And I ended up sending like 12 subjects to the North Austin Medical Center. And so it tied us up the rest of the day. And fortunately, what the drug manufacturer does, okay, so now they know the level of drug that's going to make you really sick. So they come down a percentage from that amount of drug. But there in that job, in the other research company, we researched migraine headache medication. And so that was the one that was by campus. And we had, that required a lot of biochemistry and biology knowledge to go over the data. And of course, you can always help. It helps, when family gets ill and so forth, you can try to make a picture for the family, your family members, to what's going on in their bodies. That, is something, if you become a physician, you're going to learn, that family members are going to depend on you to help clarify whatever's going on in their lives. Right, Bella?
Yeah.
Okay, what other question do we have?
Going back to your medical school experience, how was your experience in residency and I think intern? I think you had to be an intern. How was your experience there? And what are some of the coolest things you've seen or done during your time?
Now, Bella's heard some of these stories, okay, because we get to talk about some of these pretty gory. And I think the one experience that sticks in my mind, okay, and this would have been like 1980, probably about 80, 86 or so, and 85. I was an intern at Brackenridge Hospital. Now that's our major trauma center. It's always been that forever, which means if anybody's really, really sick, dangerously sick, they are brought to the Brackenridge Hospital. And I was the intern, and we would have had a surgery resident, and of course some medical students trailing us. And back then, that area around 12th Street near campus we used to call it the Gun and Knife Club, because every Friday around 5 or 6 o'clock, the ambulances would start bringing people over to Brackenridge Hospital who had been stabbed, beat up, they'd been shot. And so we were prepared for that. And on this night, the EMS people brought over about a 25-year-old, and he had been shot in the chest, and he had hit our doors. And because we're a trauma center, the residents, the surgical residents, were prepared to take a saw and cut through the ribs. You may have seen this in the movies. Take a rib spreader, which is like this thing that has like claws, and it has a a thing you turn, and what it does is it opens up the rib cage and exposes the heart. And when he did that, we saw that he had a bullet in his left ventricle, which is the big part of the heart, the powerful muscle that pumps blood out. So he had almost no blood pressure because he had a hole there and his heart was spewing out blood. So he had me jump on top of the gurney, and I'm about 5 feet tall, something like that, and I weighed about 120 pounds. And he asked me, "Would you jump on the gurney and stick your finger in the hole?" Okay, so that's what I did. And so imagine that I'm running with this patient through the emergency room. I've got my finger in this guy's chest, in his heart, with my finger in the hole to keep the guy alive. Then while we get him to the trauma room where the nurses are starting to pump blood into his veins. And we ended up giving him 18 units of blood to keep him alive. And I had my finger in the hole. The surgery resident was sewing around my finger. And then we took a rubber, it's called a rubber Foley. You probably seen those. They're like when you're having trouble urinating, they put one of those in your privates. Took one of those and put it in the hole where my finger had been. And then they started just pouring blood into the heart, just squeezing the bags through that hole. And then when I have my private practice many years later, I'm doing disability exams for the state of Texas. And this fellow shows up and he has a bad back and he's asking for disability. So the hospital, he had to get all his medical records for me to review. And there it is. The guy's alive. He's alive,
Oh, wow.
he lived a full life. And he was shocked when I told him what we'd done to his heart. But that was awesome. And now the other thing that you need to understand about the environment we were working in, it was during the AIDS epidemic. So we were all really terrified of blood because we had no treatment for AIDS of any kind at that time. And so we were all, but everybody jumped in and did what we had to do for this one guy. We had all the protective gear and everything, but even then, if that surgical resident misses his stitch and this patient has AIDS or HIV, then he would have stuck my finger. And then it'd have been a totally different, I would have had to take treatment for that. Uh-huh.
We have to start wrapping it up because Zoom gives us a time limit.
Okay.
So our next question would be, what advice would you give to undergrad students who are interested in the medical field or in the health professional field at all?
Well, the advice is, and I say this to all my mentees, and this is a saying I learned from one of my mentors: don't look so far ahead that you leave yourself behind. Okay, you need to take it one level at a time. And I always tell the mentees, the professional schools are not looking for perfection. Okay, sometimes the students get all wound up, and not because they're not making a perfect score. They're looking for you to conquer. In other words, if you have a hard time in a class, how did you overcome it? Most interviews will ask you that. Well, you made a B or a C or something here and there. How did you overcome that? And then don't be discouraged with, the economics of medicine. Right now, we're going through a lot of changes, but in the end, you're still, it's very rewarding to work for the greater good. And you're never going to be bored. The family doctor drives the car of healthcare. Okay, we're in charge of the car. Some people think, well, as a family doctor, you're not respected. Well, that's not true, because if you, Mr. Cardiologist, don't respect me, I'm not sending you another patient. And so it works. It's all economics, you know. If people want, they want you to keep sending patients, they're going to respect you, treat your patients well, and that's the way private practice works in family practice. So don't get discouraged from what you hear. It's all, you know, all the bugs will get worked out by the time you get to that level. And take your vitamins, drink lots of water, and sleep. Do not stay up all night before exams. You need to sleep at least a couple of hours.
Thank you so much.
Thank you. Thank you
You're
very
welcome.
much.
I enjoy talking to you all. And hook 'em.
Bye. Thank
Bye
you.
bye. Bye, Bella.
Bye, doctor.
I love it.
Yeah, she's badass.